Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me is Dr. William Gillespie from Gastroenterology Associates of Columbus. And today we're talking about the new guidelines when it comes to colon cancer screenings. Now listen up about this because it can save your life. Welcome to the show, my friend. Nice to see you.
It's great to be here.
Before we get into the new guidelines, I want to talk a little bit about why would we be needing colonoscopies and what is a colonoscopy for people who may not know. But they should.
Right. So essentially, a colonoscopy is a way to detect and prevent colon cancer. So everybody has these what we call polyps that grow in the colon as we get older. And if we let them go for about 10 years, they can turn into colon cancer. So we'll go in and try to take them out before they become colon cancer.
I did not know. You just gave me some interesting information. I did not know that we all get polyps.
Not everybody does, but a lot of people do. A lot of it's based on genetics. We don't know exactly why yet. But the majority of people will get polyps at some point in their life.
All right. So who's come up with these new guidelines? Is it just the state of Mississippi or is it national?
No, so, I've heard some people say, well, of course, gastroenterologists want to do more colonoscopies, so they're lowering the colonoscopy age. But these guidelines actually first came out in 2018 from the American Cancer Society.
Right.
And then it's been adopted by the U.S. Preventative Task Force and then all of the GI societies. So it's actually, everyone that studies cancer has recommended that we lower the age of colonoscopy to 45 for several years now, but insurance is just now starting to pay for it.
They've just picked it up. So now the best thing is that at 45, does that the same age if you have family history, or does that become sooner rather than later?
That is generally if you have a first-degree relative, so your father, your mother, your siblings, you usually start getting a colonoscopy at age 40. And that's remained the same. But now the age is 45 for everyone, regardless of family history or anything else.
I've always wanted to ask this. Colon cancer, I know it can be genetic, but some people can get it without having genetic background, right? Mm-hmm. Is it a lot to do with our health and lifestyle?
It can.
Like environmental factors?
Possibly. We don't entirely know. Part of the reason we've lowered the screening age is because people 50 and older, the colon cancer rate has been declining because we're doing a good job of screening for it. But the rate of colon cancer in younger people has doubled over the same period.
What have you found?
We're not entirely sure. We think it may be something to do with Western diet, obesity epidemic, highly processed foods, but it's something that people are still looking into, so we're not entirely sure yet.
Are those guidelines the same for men and women?
Yes, men and women, every race, everybody age 45.
And we just need to make sure that our insurance is covering it as well. Double check with your provider.
Yes.
I do want to ask you, when it comes to having the procedure, okay, can we just go through that process? I've come in and had a consultation with you, or I've been referred to you, and you said, yes, Troy, you're going to be coming in on Friday. Then what? Well,
the night before, you'll drink some colon prep that basically cleans out your colon. Then you come in the next morning. We use anesthesia to do our procedures, so the patient's totally asleep. And then we'll perform the colonoscopy, which takes about 20 or 30 minutes. And then afterwards, if everything goes well, they're able to go home and go back to work the next day. So it's really not too bad.
It's so simple, right? And we want everyone to know the drink the night before is not like it used to be.
Yeah, they've got some better stuff now.
It's really good. Thank you, buddy. We really appreciate it.
It's great to see you.
Thanks for coming in. If you want to find out more information from Dr. Williams Gillespie, head over to Gastroenterology Associates of Columbus. Back after this short break.